Hang on. Hopefully that started anyway. And then I will just share your presentation, Pauline. So I'll hand over to you. Okay.
Brilliant. Thanks, Tom.
Just give us a sec. It will take a couple of minutes to share.
That's all right. So looks like it's doing something. My name's Pauline, as Tom said, and I'm a physician associate working in Thurrock in primary care. And I also work as an ambassador for Mid and South Essex and across the east of England for HEE. So I get some time to speak to people who are looking to hire PAs and to support the PAs who are employed in the east of England. So thank you all for coming this afternoon. What we wanted to do was to have a webinar where you get a little bit of information, and then we want to give you some time to talk, ask questions. I can see that some of you on the chat have got PAs and have had PAs working in your practice or PCN. And I really want to hear perhaps the things that have worked really well, the things that have not worked quite so well. So what can we learn for the next 12 months of hiring PAs into primary care? So next slide, please, Tom. So it's a little bit about PAs. Hopefully you all know what a PA is. They are science graduates who complete a 2-year clinical. It is now mostly all masters in physician associate studies. And I can tell you it is an intense 2-year full-time. It's not an academic year. It's a full-time course with at least 14 hours on clinical placements over the 2 years and over 3,000 hours of teaching, plus your own self-directed study. So there is a huge amount of information that's given over in those 2 years. And there has been a huge expansion in courses over the past few years. When I applied in 2014, I think there were 3 courses, and now there are over 30. So there's a huge number of PAs being trained, and we expect around 1,000 physician associates to graduate each year from now on. And that's, some places graduate in September, some places it's in January, so it's all year round. The biggest number come out in September, and we'll be looking, they'll get their results in the first week of November. So that's the biggest. The next biggest then is January, and they get their results in March. And then May is a smaller cohort of exams, but they kind of come out, I suppose, November and March. Next slide, please. How do we work? So in primary care, it's clinical supervision from the lead GP. Day-to-day supervision can be from an experienced PA, another GP, an AMP. It's whoever is appropriate and qualified to do that. A new graduate will need more hands-on. So if you think there's a lot of theory given in the 2 years, but some PAs, quite a number of PAs, will come from a degree. They'll do a 3-year degree, then they'll come and do the PA course, and this might be their first full-time job when they come out of university. So it's quite a culture shock if you're brand new to the healthcare and you work in primary care. So it's just recognising what you've got, what you've employed. They are a fantastic investment, but it might take you some time to get a fully working, seeing as many patients as you think they should. It might take you a little while longer than you think to get that PA. But once you've got a PA and they've been working in the same place for 2-3 years, supervision does become more fluid and can be remote at the end of the phone, because what you've got then is somebody who knows their limits, knows what they can do, takes the patient as far as they can, and then asks for help. And in primary care, that doesn't have to be there and then. It can be at the next appointment or a referral on to secondary care. The downsides, we're currently unable to prescribe, but we do have pharmacology teaching, and I would expect a PA to be able to explain how to start a medication, know how to monitor it and review it, and know what to suggest in certain circumstances. We Also can't request X-rays and CTs because we're not a regulated profession. And unfortunately, regulation has now been put back to 2023, which is something that we're all coming to terms with, and we're all really disappointed. Next slide, please. Okay, so what can we do? We can manage our own list of telephone appointments, face-to-face appointments, home visits. We do the examination, the history taking, management of the symptoms. So we can recommend prescribing via electronic prescription. We can order blood tests, ultrasounds, recommend X-rays, interpret results, file the hospital correspondence, refer patients to other specialties. We can do the 2-week wait referrals if we recognise that they've got some red flag symptoms. We can complete audits and quaff, administer flu vaccines, COVID vaccines. And some PAs are clinical directors of PCNs or partners in GP practices. And we'll do the next slide because it's colourful. You might have to press it again. So the list, what we can do, goes on and on. It might be easy to say what we can't do. And there's very little we can't do because we will take something as far as we can and then ask for help, however that may be. Next slide, yeah. So the issues that we have is that now PAs are being employed across PCNs. PCN, we have 10 practices. So when everyone's trying to get a slice of that PA, it makes life tricky for that PA, especially if they're brand new. So if you imagine they're brand new, they've never worked full-time before, and now they have to work across several different practices. It's quite sophisticated for a new member of staff to think about, well, if I'm off sick, who do I need to let know? How do I get in contact with this practice that I might only go to on one Wednesday, every other Wednesday? So it's just working through practicalities that they may not think about. And these new PAs need support. Who is going to give the daily support if they're working across different practices? So we recommend when they do the foundation programme that if you are employing a brand new PA, that you limit their work across 2 practices only, just so that they can get some consistent supervision and consistent messages. I think I'd be really interested to hear from people who've employed PAs across the PCN for any advice and ideas for going forward. Yeah, and it's just about how do you let practices know about the PA and who's coming in and how to best utilise them is probably the best way, what to put on their list.
I think it's probably just to add, Pauline, isn't it, as well, from a training hub point of view. I know that us in Mid and South Essex as the training hub, but I know in BLMK and Norfolk and Waveney and all the other training hubs in the east of England, I know are working on how we can embed not just PAs but all the additional roles, all the AHPs, all the direct patient care staff, a little bit more. Not better, but in a more consistent way, so they feel supported and embedded. So we can obviously, after this webinar, we'll share all the details of all the training hub contacts, but also the PA ambassadors across the east of England as well. And maybe that might be a good conversation to have about how we do that going forward for your practice or PCM.
Perfect. I think that's it, Tom.
Yeah.
I really wanted to keep it short so that people
that's fine.
Ask questions. So that's my email. That's probably the best way to get me, actually. So if you're thinking of hiring a physician associate, and what support do you need?
Yeah. So should we leave any? There is a question. There is a question just in the chat that we probably from. That looks like from Tahir. He's just got his hand up. Tahir, do you want to come in?
Yeah. Thank you very much for a very informative chat. And your presentation is brilliant. Almost all questions. Sorry, can you hear me?
Yeah, we can.
Sorry. Yeah, I think that was someone else with their microphone off to hear. Sorry.
Sorry, that's okay. Thank you very much for this informative webinar. Brilliant. It was long awaited. And the question is very simple. Can they work as a PA in the surgery if they haven't passed their national exam?
So there's no legal reason that they can't, but you would want to question, have they taken their exam? Have they failed their exam?
Yeah.
If they failed their exam, do you want them working with your patients?
They failed their exam.
Yeah.
And but my question was about indemnity cover. How would we cover them or include them as an indemnity, group indemnity or personal indemnity, as a PA or something else?
Or Kunal, do you want to answer this question?
So it is a difficult kind of situation to find yourselves in. Until they've qualified and passed their national exams, I don't think you can indemnify them as a PA because they haven't fully qualified. So it'd have to be something you discuss individually with the medical defence organisation. And the likelihood is they may give similar cover as they do for healthcare assistants. So healthcare assistants are unregistered healthcare professionals, and PAs are also not regulated by a body at present. In those kind of situations, what the medical defence organisations will probably advise is, as the employing organisation, you have to reassure yourselves of the skills and capabilities of the employee, i.e. in this case, the PA who hasn't passed this national exam. But the likelihood is they will provide indemnity for them going forward.
Thank you. That's the answer I was looking for. We were thinking the same lines. And one more last question. Sorry about that. The area we're working, there's a lot of interest for the PAs to apply for the volunteer work placement. I know they're getting placement in their different surgeries, but local student PAs, they want it. But I'm not sure that we can accommodate them if they need any paperwork. So can they have an extra personal experience without having any additional workload, paperwork to be completed from us?
So are these PAs who are on a course?
Yeah, on the course, undergraduate and postgraduate, they wanted to come the surgery as a volunteer and have the personal experience, work experience as well, on top of what they're getting in their own surgeries.
Wow. That's just really dedicated, isn't it? So I don't see how, I suppose the only thing is, as long as they've signed a confidentiality agreement, I don't know, do they need anything else?
No, so you'd probably treat that as you would any work experience. So they'd have to sign your confidentiality agreements, adhere to your policies and procedures, infection control, fire, etc. And if they're there for kind of work experience, then it would be they're sitting in, they're not seeing patients independently going forward.
Thank you very much. Thank you.
Yeah, just conscious of time. Thank you for those to hear. But obviously, depending on what area you're based in, I'm sure you can follow up with either Pauline or Kunal or your PA ambassador within your locality, and we'll send all of those details afterwards. So, don't think there's any other hands or any other questions, but just conscious of time. So if we move on to Kunal, who's going to talk through, I believe, a bit about physician associate supervision and the foundation program, and then we can come on to any questions at the end. I've just seen Lucy's post in the chat as well, and we'll come on to that afterwards. Okay.
Brilliant. So just to introduce myself, so my name's Kunal Chandarana, and I am a GP partner and the training program director for the Primary Care Physician Associate Foundation program. And I'm just going to spend a few minutes just talking about the program and PA supervision in general. So if I'm going to be honest, before I took up the post of the training program director, I did have very little experience with PAs. And I think for practices who don't employ a PA, you're probably in the same boat I was around a year ago. And if I'm going to be honest, I was pleasantly surprised by this group of professionals. I was expecting them to be at the level of an FY1, and I think that's what the kind of expectations are. But actually, some were probably at the level of a GPST1, so had a lot more experience of primary care than I was anticipating in the early phases. But regardless of this, PAs are dependent physicians, so they're not independent physicians like GPs. And therefore, we do need to appreciate that as soon as they qualify and go into primary care, there is a big jump from going from theory into actual practical medicine. And what we also need to appreciate is when junior doctors do this, often they go into primary care as an FY2 rotation or an ST1 rotation, where they've had some practical experience, whereas physician associates may go directly into primary care from qualifying. As a result, they do require additional support, particularly in their first year. And at the start of employment, the Faculty of Physicians Associates generally recommend PAs should have 30-minute consultations with debrief after each patient. So something similar to what you would do with a foundation doctor. And we echo this in regards to the foundation program as well, where there's a learning agreement. And we generally advise they should remain on 30 minutes for the first 3 to 6 months, and then the time adjusted based on how they are developing. Within the first year, the Faculty of Physicians Associates also recommend some work-based assessments. And what we've tried to develop in regards to the foundation program is to anticipate actually there is a bit of an investment, particularly in the first year of qualification, that practices need to invest in their PAs. And therefore, as part of the foundation program, we generally offer each practice £5,000 for their time and supervision, 500 of which is for a study budget. And for this remuneration, we expect the PAs to be released for an educational program that runs 30 weeks of the year for half a day. And we also expect for the remaining 22 weeks of the year, they have half a day for self-directed learning. And this funding is also meant to reward or actually acknowledge that practices may have to do some work-based assessments and supervision, particularly in the first year or so. But like junior doctors, if you invest the time early on, they will develop and grow into something that is very valuable within your surgeries, and they can start acting in a more kind of independent role as they gain an experience in certain areas within their capabilities. And they do pay dividends with time as well. So the way I kind of see these is like having an ST1 GP trainee, but the issue with the GP trainee is that they move on after 4 months, whereas the PA can remain with you for years to come, and you can train them up into do whatever role you want to help ensure your practice is resilient going forward. So that's just a brief summary of the foundation program. Generally, feedback from the PAs is they've found the foundation program very supportive. They get to meet other PAs, find out how other PAs work. They've built up peer support groups, but they've also had formal teaching to help them develop in primary care. And we're there to support the employers as well and acknowledge that taking a PA on, particularly in the first year, may require some investment on their end, and therefore there's funding there to acknowledge that as well. So I'm happy to answer any questions you may have.
I think Kunal as well, it might just be before anyone wants to come in as well, just stop spotlighting you for a moment. Hang on, there you go. We've had, I think it's 15, wasn't it, Pauline, in Mid and South Essex, or something similar, so between 10 or 15 who went on the original cohort of the PA Foundation programme or applied to that. And I think the vast majority have really found that, and the practices have found that really, really interesting, and has been a real support. And I know that we've got PAs in Mid and South Essex that we're looking to, we newly qualified 14, 15 months ago, who've really made real impacts, both to population health within their surgeries, especially in areas of deprivation, and have supported access and demand, obviously during COVID as well. So I think that's really important to know. Are there any questions at all with regards to physician associates, what they can do, or anything about the foundation programme at all? I think we've got Lucy's previous question, what would a normal day for a PA look like? Is that something that either of you want to come in on?
Well, it depends how long they've been qualified. So my day looks just like the AMP that I work with. Looks very similar to GP list. I might have slightly longer because I generally I have to find someone to sign my prescriptions. But yeah, it just starts at 8 and it finishes at 6, and there's a lot of people in between, and that's it really.
And you, Pauline, as well, just as an aside there, I don't know if it's interesting to others, but your kind of your day, or what generally a PA coming into a practice would look like, is that kind of mainly you seeing face-to-face appointments? Is it a mixture of hybrid kind of?
So our surgery, we always did telephone triage even before COVID. So my day was always telephone calls and then some face-to-faces. So that hasn't changed. We've probably got a lot more telephone consults and e-consults. So just trying to work through the list. I also file a lot of letters and bloods, and I see anyone that needs face-to-face in my day. The newer grads would have 30 minutes to do all of their patient contacts, because they need to build up that. It's like when you start running a marathon, you don't run a marathon, you run a bit and you walk a bit. So it's the same for them. So they just need time. It takes a lot of time to build up that skill where you get people into your room and then you get people out of your room within a good length of time, rather than 40 minutes. So
it's like a registrar, isn't it? GP registrar, you wouldn't throw them in at 10-minute, 15-minute consultations immediately, would you? You start 45 minutes, 30 minutes potentially, and work one's way down as you gain that competency and experience, don't you?
Yeah.
But okay, perfect.
Part of that is the confidence to say, this is what you've got, this is what we're going to do, and that's what takes the time, and you can't fake that. But some people might be able to, but you can't fake it, and patients know, and they'll just sit there. Oh, are you sure? Just do this. So.
Yeah, no, exactly. I've just we've just got a couple of questions in the chat, but Ina, you've had your hand up for ages. So would you like to come in? I wasn't ignoring you.
Oh, hi. Hi, no, that's okay. It's not urgent. We have so I'm a GP partner, and I've had PA students from the Hertfordshire University for the last 3 years, and in the last year we took 2 of them, and we've got them since when they passed their exam in university. So that was July time, and we've had them from that point until now, and now they've just passed their national exam with a lot of support from us, and now we're thinking of perhaps putting them onto this course, on this foundation course, but we are not paying them within our PCN budget, because we use that budget, so we're self-funding for this, and we are not sure whether we should be doing this year or next year, whether we should be doing a bit more supervision now and then putting them on the course next year. I mean, I don't know. What is your experience? And did you say, Kunal, that they get 1 session, so Thursday morning, sort of at the university, and then do they have to have also another session for self-study?
No, so it's very, very exciting that you've got these new PAs in your practice. In regards to the foundation program, currently application for the 2022 cohort is open. I've got a link to our website in the chat.
I've already completed it, yes, and
perfect.
We've got them verbally accepted.
Perfect. So in regards to funding for the program, the funding comes from Health Education England. And as Pauline said, there are a number of newly qualified PAs on an annual basis. And therefore, what Health Education England have advised is the funding should be for newly qualified PAs within their first year of practice.
I see.
So the risk is, if you delay enrolling them onto the program by a year, and then we have more people applying the following year, and they're all within a year, then it's unlikely your 2 PAs will get a place on our program.
I see.
In regards to places, we have a number of places on this year's program that commences in 2022. So we haven't had enough, correct. We haven't had enough applicants yet to fill all the places. So I'd strongly encourage any practice that has recruited a PA or is in the process of recruiting a PA to potentially enroll them onto this program, because there is funding for the practice. In regards to the program, as Ina quite rightly said, the program runs on a Thursday morning. So we expect the PA to be released on a Thursday morning to attend the program. And we would generally advise they're released on a Thursday morning throughout the year. So even on the mornings where the program isn't running, so they have self-directed learning on the days the program isn't running. That's one of the agreements that Health Education England ask us to sign with the practices, so the PA has enough time for self-directed learning. We wouldn't generally say they need to have another session on top, although Health Education England state practices can consider an additional session for well-being. So instead of having 9 clinical sessions per week, some practices may give their PA 8 clinical sessions, 1 session to attend the program, and 1 session for audits and kind of a well-being kind of session. But that isn't set in stone. The only thing that's set in stone is 1 morning per week to attend the program or for self-directed learning when the program isn't on.
I see. Okay, that's really helpful. And with that course, they need to have a supervisor who will be doing CPDs and mini cases with them. And how much time do you think realistically that will take that GP, a week or a month?
So realistically, do you have GP trainees or not?
Yeah, we do. Yeah, we have many. I'm the program director for GP training. So we have GP trainees, many GP trainees. Yeah.
Perfect. So the case-based discussions and the mini cases are similar to the way you do it in GP. What we generally advise is, because in the early phases they're on 30-minute appointments and they will debrief. Quite often you could just do a case-based discussion or a mini case as part of the debrief at the end of it.
Oh, that's very good. Okay.
And that's probably the best way of doing it, as opposed to additional time.
Separate time, good.
Yeah.
Okay.
If you decide to give it separate time, the likelihood is you could probably do them in 3 kind of mornings. And it could be when the program isn't running on a Thursday morning, if you're able to do a supervision tutorial 3 times a year, you should be able to get all the mini cases and the case-based discussions done that way as well. So it depends on how the practices want. The other thing I just wanted to highlight is, even if you didn't enroll the PA onto our program, this requirement of the case-based discussions and the mini cases is actually from the Faculty of Physician Associates. So practice would still be encouraged to strongly do them.
To document that somewhere.
Yeah.
Okay.
And the likelihood is, when the PAs are revalidated by or get GMC approval and go on GMC register, they'll probably want to see some evidence of that. And the other aspect of this is, even if you didn't enroll them onto the program, when you have things like CQC inspections, they'll need to ensure that all members of staff, all clinicians, are able to have the supervision they need, the debriefs they need, and they have continuing professional development. So they would probably want to see some evidence of this going forward.
So you may be better off putting them on this course anyway.
Yeah,
so that's really helpful.
The course isn't meant to, so all these case-based discussions, the mini cases, we're just mirroring what the Faculty of Physician Associates say. The only real investment you're making by enrolling them onto the course is to release them for half a day for a year, but that's then training them up, and there is funding associated via the program for that.
Okay, that's been really helpful. Thank you.
Brilliant. And I think you'll be surprised by the amount they will come on in that year. And sometimes meeting others and talking to others and going, oh, you're doing that? Oh, well, maybe I can do that. So it just kind of broadens their horizons to go, oh, that might be something I can do as well in my practice, and then come back to you. And I think it's just...
Well, you see, I'm actually very pro physician associates, because I've been having them as students, but I find that it's a difficult sell with my partners, because they require so much investment of partner time that you know, and it will probably be the case for another couple of years, and it's hard. And if I've been sort of saying about this course and this, they're saying, well, how much more
hard to look long term in there, isn't it?
It's difficult,
but there's no guarantee of retention.
No, and when you haven't had a qualified PA who's worked, it's really hard to think, well, how are they going to get from being a student? What will they look like? But yeah, that first year, they just come on in leaps and bounds.
Thank you very much for everything. Thanks.
Brilliant. I'm just conscious of time. We do have a couple of questions in the chat, but I'll just come back to those in a moment. And we've got another hand up. That's from Santana. Apologies if I've pronounced that incorrectly. Do you want to come in? Hello. I don't think we can. I don't think we can hear you, Santana. Sorry. Okay, we'll. Oh, there you go. Have you unmuted yourself now? If you post a question in the chat instead, Santana, because we can't seem to hear you. Okay. Just to go back to the questions in the chat at the moment. So I think we've got Kunal's kindly put the Physician Associate Foundation intern program into the chat. We'll email that out. You'll have to forgive me. I am on leave today, so I'll probably do that on Monday, but that does still allow you time to be able to get that, and you should have been sent that by your training hubs and HE already anyway. I think you've answered that. How likely are surgeries to get this funding? Are there enough places available? By the sounds of it, there's less applicants and spaces already, which is good because there's space, but obviously we want to get those filled. A question from Sarah is, does the foundation program last all year or just 32 weeks?
So it lasts 30 weeks of the year. So there's 3 terms of 10 weeks each. Starts in mid to end January, 10 weeks, then we break for Easter, then 10 weeks during the summer, and then 10 weeks during the autumn term. But as I mentioned earlier, we would still want the PAs to have a self-directed learning session when the program isn't running. So you're pretty much investing half a day a week for a whole year.
Perfect, thank you, Kunal. Another question here is, I don't have a trainer in the practice, so I'm assuming they mean a educator or clinical supervisor. So can we still have one, is the question.
So Health Education England have generally encouraged all PA supervisors to be health education approved clinical supervisors. Now we understand that's not going to be possible for the 2022 cohort because there's lots of practices interested in recruiting PAs, and there's not enough time for a GP to be trained up to be a clinical supervisor by then. So for the 2022 cohort, you don't have to have a trainer in your practice. We're still happy to allow you to enroll your PA onto this program as long as a GP is willing to be their supervisor from the practice and to help them with their assessments. If you're planning to have PAs going forward and you're planning to have new PAs and you want to enroll new PAs into a cohort from 2023, we would strongly encourage practices to nominate one GP to become a clinical supervisor. Now, Health Education England run courses. There's lots of information on their website as to how you can do this, and they've made the whole task a lot less onerous. And the benefit of that is if you then decide you want GP trainees over trainees, it will become a lot easier for your practice or PCN to do that going forward as well.
Perfect, thank you. I think that's really clear. Just got another question on here from Tahir, which is, if a PA is expected to pass their national exams during January sitting and the surgery take them on, would the funding for the programme be available for this year? And it's put, I know the programme starts in January while results are announced in March.
So short answer, yes. We'd still encourage you to fill out the application forms on our website, but on that, make it clear that they're expected to get their exam results in March and make it clear as to when they can start working in your practice. But yes, we're still more than happy to consider those applications going forward.
Perfect. And I just wanted to also say as well, the question from the practice manager at the London Road Surgery as well about the trainer that we covered it previously. All the training hubs should now have expansion leads or will have GP expansion leads in situ. And a massive piece of work I know for us is about expanding training capacity across our locality, but across the east of England in general. So I know for us in Mid and South Essex, we provide reimbursement to support GPs to be for almost like backfill, so a locum can be found or someone else can work, so they can attend educator sessions with HEGP school, and we're trying our best to support that. So please do get in touch with myself, and if it's not for my area, I can pass you on to one of my colleagues in your area to support you with that as well. We don't want there to be any barriers to be able to have a PA or to be able to support people training in general going forward. Another question, the last one from Santana. Apologies that we couldn't hear you before. A question there is there a cut-off regarding age criteria for patients? For example, can a PA see babies under 1 year old, for example?
Yep, we can. You might want to not give it to somebody on their first day, 8-week-old on your first day, off you go. But yeah, again, it's that thing of getting used to seeing lots of patients. And as long as you've got an open door policy, that PA is more than happy to see that child. And then if they're worried, they can come and talk to you and you can go see them as well. So it's just having that in place. Yeah, I see children all the time.
Perfect. I think that just shows you I think what we found I think we have 25 PAs across our system, which is a lot more than what we thought we would have at this point. And in Mid and South Essex, I think we've seen those practices who have put that time into those individuals have found the PA role so invaluable. So I think that's probably one of the things that I would say, that we appreciate that there maybe is some work to support individuals, especially newly qualified, but I guess it's that long-term view, isn't it, about how we are developing a workforce that is almost, you've grown your own, you've taken out of qualification and you're using them to, in the way that is best for your patients, because it's different in every area. So if you can get that kind of workforce who have come from the ground up, then you're going to be really successful in the future with regards to your sustainability. Another question is from Tahir, just again, if a surgery is willing to pay for training courses for PAs, what are any recommended areas, if any?
It's down to the PA. What do they want to do? So the Faculty of Sexual Reproduction and Health has a diploma that's open to PAs. If that's what's needed in your practice.
Of GPs who have that qualification as well. So
yeah, they can go on that and help you out in that way. Diabetes courses, anything that your PA is interested in that will help your practice and what you're short in is the short answer.
And what I would say, it goes back to that workforce standpoint as well. I mean, I'm probably a bit biased as someone who's all about workforce development in primary care, but if you're willing, it's great if a practice is willing to invest that money or time in an individual. Ask them what they want, what's their plan, what do they want to be doing in a couple of years' time for the surgery. You might be surprised that actually it might not be clinical courses that they want or CPD, it might be leadership. And then that's about linking with us as a training hub or your training hub in your area, seeing what's already pre-funded. You've obviously got the foundation course as well. And then if there is something that isn't funded but would be really exciting for that individual, invest in them, and then you've got that workforce for the future who are trained up to support as well. And that's about also considering things like the new to practice payment, new to partnership payment scheme as well for PAs are included on that. So we know we have a shortage of GP partners, and experienced PAs like Pauline who've been in leadership roles, who manage teams and things like that, would be an excellent addition to a practice at a partnership level as well. So we know that's not something that's going to happen immediately. We know that we're going through this transformation to more multidisciplinary teams and leadership models, but for the future, that's going to be really important, I think. Are there any other questions at all? Any ones I've missed off, or anything you guys want to add, Pauline or Kunal?
No, I think it's all been said.
Right on time then, if not a little bit earlier. Thank you, everyone. I'll end the recording now. If anyone's got any questions, you will get an email, everyone who's attended today, with all of our contact details, the slides, the information on the programme, and also your contacts for each training hub in the East of England HEE team. If you've got any questions, please don't hesitate to contact myself or my team as well, and we can point you in the right direction. But and we'll share this recording, so please do pass on to practices in your PCN who probably, if they've, I know we don't have spare time, but have got some time to have a look at this, then it might be really appreciative. Okay. Thanks, everyone. Yep. Cheers.
Thank you. Bye.
Bye.
Thank you.